Hi everybody, my name is Kendall Crummey, and for my career research project, the occupation that I have chosen is a physician's assistant. What exactly is a physician's assistant, also known as a PA? Well, they're a licensed medical professional that provides direct patient care. But what's the difference between a PA and a doctor? Well, a PA has less liability, they have more flexible hours, and they are not licensed to perform surgery. Doctors and PAs do work hand in hand in clinical environments, and PAs are also able to assist doctors within surgery, but they cannot perform it on their own. Educational requirements. When going to a university or college, there are many choices of majors that you can choose from to become a PA. Some of them are biology, chemistry, biochemistry, nursing, and any other health-related major. You must obtain a Bachelor's of Science as well as a Master's degree in Physician's Assistant Studies. Certifications and licensures. There are a couple certifications and licenses that you can obtain to become a PA. The biggest one is a PAC, and that comes from the NCCPA, also known as the National Commission on Certification of Physician's Assistants. If you do not have the PAC certification, you cannot actually become a PA. Licensing. You must obtain a license in the state that you are trying to practice in, or else you won't be able to practice any form of medicine. Another certification that you can obtain is a specialty certification, but that requires you to complete 4 prerequisites. You must complete a CME, which is a specialty continuing medical education. You must complete procedure and patient case logging. You must have experience in the specialty that you're trying to go into, and you must take a proctored specialty exam. For PAs, they actually don't have to specialize in a specific area of medicine. They can bounce between any area, such as cardiovascular, orthopedic, OBGYN, pediatrics, family medicine, and any other area of medicine. But if they choose to, they can specialize. Graduate school. As I said earlier, you must obtain a master's degree by going to PA school. It is a 3-year-long program. Half of it is dedicated to ethics, policy, and management, while the other half is dedicated to gaining actual clinical experience. There were 3 PA school programs that I looked into from either Baylor University, Texas Tech, and University of Texas Medical Branch in Galveston. But the main one that stood out to me, because I personally want to go there, is UTMB. For that PA school, those prerequisites are a minimum of a 3.0 GPA. You must complete and pass a GRE and CASPER exam. You must complete the 47 to 50 hours of prerequisite class hours for the master's degree of Physician Assistant Studies, and you must have 3 letters of recommendation. I have linked on the bottom of the screen the page that I looked at for the PA school requirements. Daily workday. For this portion of my assignment, I interviewed Anthony Houston. He is a PA at Elite Emergency Physicians Incorporated, and he specialized in emergency medicine, which deals with the ER. He told me that there were 4 daily tasks that he had to go through for each patient that he saw. He must assess, diagnose, treat, and discharge each patient. He also told me that each workday was different. It could range from a wide variety of slow day 15 patients to a busy day of 30 to 40 patients. Professional organizations. There is one large name for PA organizations. That's the AAPA, also known as the American Academy of Physician Assistants. It is a national professional society of PAs and keeps updated information about anything that you could possibly have questions on, ranging from basic knowledge of what a PA is and what exactly it entails, all the way to job opportunities and updated research. I have also linked that website on the screen as well. For the Indeed.com sample, the job that I found is just titled Physician's Assistant. The qualifications that they require are a PA license, of course, acute care experience, EMR assistance experience, and an APRN license. For skills, they're looking for prior work experience either as a PA or a nurse. They want knowledge of procedures regarding exams, recovery, and therapy. They want a problem solver with multitasking capabilities, a caring, compassionate person, and a team player with good communication skills. And here's my reference page.